what is PCOS? PCOS stands for polycystic ovary syndrome. This happens 1 in every 10 women of childbearing age. This means after puberty, a woman can have PCOS. Normally the ages are between 15 and 44, but they can also vary. It is very common and it is treatable. So, in the ovaries where everything is happening, normally a woman will release an egg, which is her menstrual cycle, every month. With women who have PCOS, the egg might not be developed or it might not be released, which can cause an irregular period. The irregular period can cause infertility, which is the struggle of getting pregnant. It just makes it harder, and development of cysts on the ovaries. The symptoms can be hair loss on your head. You could have a little bit of hair loss, or you can have a lot of hair loss. It just depends. Hair gain. There is hair on your neck that grows, hair on your face and on the top of your feet is very common. Also acne. You'll have acne on your face, chest, and back, and a lot of people just use body washes and face washes to try to help eliminate some of the acne. Also weight gain. Weight gain is huge for PCOS women. And also weight loss. It is very hard or harder to lose weight while you have PCOS. It's not impossible, but it does make it a little bit more difficult. The causes of PCOS are androgens. Androgen is a hormone that males produce, but women do produce a little bit of them, but not a lot. With PCOS, they overproduce. And also high blood sugar insulin. So type 2 diabetes can cause PCOS. You can still get pregnant. It is difficult, obviously, and if you're having trouble with infertility, you can see a doctor and they could prescribe you with something. Health issues with PCOS can include diabetes, high blood pressure, unhealthy cholesterol, sleep apnea, depression and anxiety, and also endometrial cancer. This type of cancer is found on the lining of the uterus or the womb, and it can be dangerous to the woman. You can have many tests done to find out if you do have PCOS. Your doctor can do a physical test, they can do a blood test, they can do ultrasound to see if you have PCOS. So there's many different ways to find out. It's very obvious though if you have everything coming on at once. Your doctor might not have to take a blood test to see if you have it or not. But something like that would be better, just so they don't prescribe you something that you don't need. Medicines are available. Your doctor may put you on birth control, which controls the hormone level. You could be put on metformin, which is normally what type 2 diabetes people get put onto. It just helps regulate your insulin levels. They haven't proven that it helps with hair and the hair growth and the acne and all of that, but it does help regulate the weight, or it can help you lose weight. Or you can do it the old-fashioned way and just take in-step home things like, losing weight at home, eating healthy, changing your diet. Don't eat all these fatty foods. They have pamphlets that they can give you to help you if you don't want to be put on medicine. So with pregnant women, they can have a miscarriage with PCOS. It is very common. They can also have preeclampsia, which is the swelling of the feet, hands, and face, and it does cause high blood pressure, which can be very dangerous to the woman and the baby. This happens after the 20th week of pregnancy, and they most likely would do a C-section to go ahead and get the baby out before you or the baby gets harmed. And gestational diabetes, this only happens when a woman is pregnant and falls under the category of them. It can be dangerous. You just have to stick to a very strict diet. So that's it for PCOS. Thank you.